It's a pleasure to see you all here this evening at the Richmond Hospital Foundation Community of Care's celebration. I'd like to start by asking you to reflect on the word community. How do you define it? What does community mean to you? The traditional definition of community is based on a shared physical location, a group of people living together in the same place. But just as our physical communities have changed over time, so has its definition. Today, you can find community among people who share a goal or a purpose. You can find community around people that have common interests, attitudes, and culture. You might find community in physical space, maybe even online, but together you share an identity. You belong. Today, we've come together to celebrate our shared purpose in healthcare, to create a community of care here in Richmond, and acknowledge the work being done to help us achieve this. As Chief Operating Officer for Vancouver Coastal Health Richmond, I want you to know how passionate I am about healthcare in Richmond. As Natalie mentioned, I grew up in a small town, Cape Breton, Nova Scotia. My father was a doctor and my mother was a nurse. So, as I say, healthcare is in my blood. I've worked in healthcare for over 25 years in many locations all throughout the US, from Alaska to the Virgin Islands and Boston to California, and then of course back here in Canada. And there's such a strong sense of community here in Richmond. And like Natalie said, it's one of the reasons why I chose Richmond 4 years ago. It reminds me of where I grew up. It's a place where friends and neighbors care for one another. So my dreams and aspiration for Richmond are to ensure high quality care when and where people need it. Here in our community of care, we are on an exciting journey to create programs and facilities for specific population groups, such as older adults, youth, children, and families. This will help create communities outside the hospital where patients can find and receive the care and services they need. So let me give you an example. Let's say you're currently supporting your aging father with his physical and mental health. A few months ago, he had a hip replacement and is now receiving home care supports, as well as seeing his physiotherapist to regain his strength. He's also begun to show signs of early dementia. So in our current system, accessing these services in primary care, mental health, and home and community care would require appointments in many different locations. Your father would also have many different care teams who may or may not be communicating with one another. In the new community of care we're envisioned for Richmond, your father would be able to access all of these services in one integrated system, a one-stop shop, so to speak, for all of his physical and mental health needs. He would have one care team, one care plan, with one lead clinician advocating on his behalf and working collaboratively with other members of the healthcare team to ensure he's receiving the care he needs at the right time, at the right place, and from the right people. This shift or reorganization of our services allows us to wrap our care around the patient population groups, older adults, children and their families, as well as for youth, providing a simplified delivery system outside of the hospital. To deliver on this vision, a number of projects are underway that will help build this community of care. For youth, a new center called Foundry Richmond will integrate health and social services, as well as peer and family supports all under one roof. It will give youth access to primary care, public health, and mental health and substance use services, and help eliminate barriers to care. We look forward to welcoming Foundry Richmond next year and integrating these services into one location to provide easier and faster access to care and make a real difference in the lives of youth in our community. For adults and older adults, we are opening a new community health access center a project that has been dreamed about for well over a decade. As you probably know, Richmond has the fastest growing seniors population in the province. And therefore the needs, our healthcare needs, are escalating rapidly. The new Community Health Access Centre will be located just down the road here on Alderbridge Way. And it will create a single central location for the delivery of healthcare services for older adults. The centre will bring together programs and services that older adults often need, including things like chronic disease management, rehabilitation, home health services, and our specialized community clinics. The intent is to provide comprehensive care so that seniors remain healthy and live independently in their homes for as long as possible. To help better serve seniors when they do come into the hospital, we're creating a new acute care unit for the elderly, or an ACE unit as we're calling it. This is set to open next month. Elderly patients often have very complex medical needs, often with 2 or 3 medical conditions or more, and therefore they need specialized care. The new ACE unit will be led by a geriatrician as well as a geri-psychiatrist, and along with an allied healthcare team will provide comprehensive geriatric assessment and stabilization in an elder-friendly environment. Last but certainly not least, a new acute care tower. So there are 3 main buildings at Richmond Hospital. The original one, the North Tower behind me, is over 50 years old now and in need of replacement. It's seismically unstable, it's too small, and quite frankly, it's obsolete in meeting the needs of our growing and aging population. In March, the provincial government announced approved our concept plan and announced the business plan. That was a big day for the community of Richmond. We're extremely excited about the opportunity to plan from the ground up a brand new facility that will allow us to dream big about the future and about how acute care should be delivered. So, what does the future of healthcare look like for Richmond, for our community? If there's one thing I'd like to leave you with today, it's that with all these projects and initiatives, we're essentially recreating our local healthcare system here in Richmond. And it's a future we're really excited about. We're streamlining and integrating care in our community around these population groups and constructing 2 new centers or hubs to house those programs. We're anticipating the future needs of your children and your grandchildren and planning for a new acute care tower that will be here for them. That's a lot to look forward to. If you'd like to learn more about the work that we're doing for youth, adults, and older adults in acute care or in the community, I invite you to ask any one of us here at Vancouver Coastal Health here this evening. In closing, I'd like to say how grateful we are to have such a wonderful community of passionate donors, ambassadors, and supporters here tonight. With every investment from leaders like you who share our vision of great health care when we need it, we move closer to achieving our vision of a true community of care for patients, families, staff, and physicians across VCH-Richmond. Standing here today, we are a community. We share the same vision, the same goals, the same passion to provide exceptional health care for the people of Richmond. And it's thanks to your generosity that we are able to do this important work and build a community of care that we can rely on for our health needs and for future generations, whatever stage of life we may be in. Thank you all and enjoy the rest of the program.